all, I thank Dr. Babu, Dr. Lingegowda, and Dr. Abhijit for making this association and bringing people from various streams. And for the today's workshop, I also thank the Government Homeopathy Medical College principal for arranging this and inviting me. So I myself, Dr. Arul Amuthan, you can see my degrees from the Ayush perspective with the modern medicine pharmacology background. I am working in the integrative medicine department. So we are sincerely working in the integrative medicine department in various streams. So when you look at the definition of traditional Siddha medicine or Siddha, so it says that any medical system that should cure physical disease, that should cure psychological disease, that should prevent the future diseases, and that also should delay the death or healthy aging. So the Siddha Tirumular, he defined this description about Siddha, and he mentioned Siddhas created the TSM based on these four fundamental principles. So when we talk about cancer palliative medicine, we should understand that what Siddha has, something, it has some knowledge about cancer and its palliative medicine. For example, this is the termite mound. So you must have seen this in the ground, it will be coming. When you destroy it, it will come again back. When there is a rain or sunlight, inside there is a termite nest that will not be affected. It can survive whatever the outside temperature. It will make underground tunnels and it will spread to nearby places. So this is called Puttu, Huttu, different name in different languages. So in Tamil it is a Puttu. So a disease which has these characteristic features of termite mound. Okay, so the Siddhas, Agastya named the cancer as a Puttunoi, which is the characteristic is same like Puttunoi. So, and we have lot of literatures that says organ-specific cancer. So that we cannot see in other traditional medicines like Kannaputtu, buccal cancer, breast cancer, lung cancer, carcinoma cervix, and also there are more than 150 medicines. There is a direct indication for the organ-specific cancer. So with this literature background, we are actually practicing the cancer and the palliative medicine. And because it's a Kerala, I want to introduce to one Dr. C.P. Matthew. Actually, he was a principal from the Kottayam Medical College. He was practicing, he is the pioneer of actually integrative oncology in India, where he primarily integrated traditional Siddha medicine for 34 years. And he is no more now, but he says always Siddha system is a divine system, and because of the therapeutic medicines available, he used only pharmacological drugs of Siddha along with the modern medicine so that he was able to reduce the chemotherapy dose. So patient can spend without any side effect or with less side effect. Even I could spend sometimes with him to learn how he is practicing. So in Manipal, we are running a specialty integrative Siddha medicine OPD where the chronic diseases are one of the thrust area in collaboration with the National Institute of Siddha. So coming to the pain management. So we try to understand the pain is because of Vadam, Pittam, Kapham. It is how much increased or how much reduced, or it is a combination of two factors. So that we will do by pulse examination. That is the first thing. Once you understand that the pain is because of isolated, elevated pittam, then you have to give the medicine to reduce the pittam. If the pain is because of isolated elevation of kapham, then you have to give the medicine to reduce the kapham. So this is how our drug selection process is actually slightly different based on the pulse diagnosis. Most commonly, semicarpus anacardium based drugs like Balladagi based medicine, they work best in all the patients. And especially Rasagandhi Melaga, Serangotainai, these are very popular drugs. Even previous speaker, doctor, actually he mentioned Rasagandhi Melaga, very popular drugs. They not only act on the pain, but they also reduce the cancer metastasis also. Then next one, as a home remedy, we advise many things to the patient. For example, poppy seed. we use in the biryani. So we ask them to take 5 gram or 1 spoon, boil with the milk or water, then consume it. It calms their mind, reduce the anxiety and reduce the pain nociception. They can get a good sleep. Similarly, Jadamansi Kashaya and Abin Ganja based drugs, lot of drugs are there in our traditional literature, but unfortunately the Abin based medicines are now banned actually. It has to be, again brought it back to our practice. Ganja based medicines, many are there. Even few medicines are available, we are using that. And when these are not effective, then we move for the herbo-mineral preparations, where the metallic arsenic, mercury, gold-based medicine like Armo Chanduram, Chandamarda Chanduram, Navapashana Chanduram, Navapashana Sudarthal. So, because the audience are from multiple background, I will focus on non-pharmacological therapies like external therapies. So, most commonly, Vitex Nigando based oil we use as an external oil if there is a muscle spastic pain. If the pain is burning type of pain, then we have to use Matan Thailam, that is a Datura leaf based oil for external therapy. And Calotropis based oil is used when there is a rigidity associated pain. If there is a pain associated with the muscle wasting, then we use Ulandi Thailam, which is based on the black gram. Okay, so this is how our drug selection is actually differing based on pulse and the associated conditions. So few cases are there. Because of time constraint, I am not able to discuss in depth. So it's a cancer brain patient. After starting our Siddha medicine, he had a chronic headache because of cancer brain. So the headache was not there. He was able to spend his life for many years. And the given medicine is Rasagandhi Melagu Armochandram. Armochandram is a mercury based medicine, and Purna Chandrodayam. And the last one is the external therapy, that's a Varma therapy. I will talk about in the next slides. So this is another case, cancer stomach. Again, the similar medicines were given. He has a severe pain because of spread to the liver and bone. Again, after 2 weeks of Siddha treatment, pain was reduced. This is another case, cancer rectum. The pain in the back, again Siddha treatment made the painless and he was able to spend his life. The patient is still alive. This patient is still alive, lasted 10 years. And this is another patient, so pain in the left hypochondrial region because of chronic pancreatitis. So here again, after Siddha treatment, so many symptoms have started reducing. Now it is under control. So because of time constraint, I am not able to discuss much case reports here. So thing is, we have to use both oral medicine, pharmacological as well as non-pharmacological measures. Since the audience are from other medical system, I will talk about non-pharmacological measures. So simple thing is, Vitex Nigando, the Nochi, it's available common plant. You can make a decoction, boil it. That water you can actually pour as a dara on the affected painful area. It actually gives very good relief, pain relief. It gives soothing effect to the patient. And Varma therapy and other therapies also we are using. And there are many poppy seed based herbal pastes are available. You can just apply after mixing with the water or mixing with the wheat powder and water. You can apply, it will act as a plaster, herbal plaster, and they also reduce the pain excellently. And there are herbal paste we advise as a home remedy. Patient can prepare themselves, and these never cost any much money. This is the plant, the Mudakartan, Cardiospermum gallicocarbum, Sasalpinia bandak, and Moringa bark. Moringa bark is the excellent analgesic. It is equivalent to aspirin, paracetamol. Moringa bark, they can make a kashaya and drink. It works better. So even that can be applied externally also. Mustard seed, we have different formulation based on the necessity. We advise the patient to mix and apply as a external therapy. Then the kili, here these all the therapies, human touch has a role. Apart from external medicine, herbal, the person, the Siddha physician or Ayush doctor is spending time with the patient. Okay, those days India had a history of untouchability. Today we need touchability. The human touch has a therapy value. So with the herbal, with the kili, again the bundle will have different herbal formulation based on the need. And like this is also the Ayurveda also it is very popular. Siddha also it is a Pati therapy. Different oils are selected based on the condition. Next most important unique therapy in Siddha is the Varmam therapy. So you know when the cardiac patient feel pain in the left arm because of the dermatome theory, same theory, it's not only for the heart. Many internal organs are related to external points, Varma points. So for example, if you look at the base of the nose, when embryologically it is developing, it has a connection still with the ear. When similarly, we have in the human lot of the soft palate, hard palate junction and umbilicus, they are still connected with some of the internal organ. And in Siddha, there are 1008 Varma points are there. 1008 Varma points are there. These points are actually the embryologically or dermatome related points through which you can manipulate the internal organs or you can manipulate distant part. If you manipulate here, it will work here. For neck pain, you can manipulate here. So there are 12 nadis are there. 12 energy channels are there in Siddha. And each nadi has its own course, like how a river starts from the hill and ends in the ocean. Same way, for example, we know Idagala, Pingala, everybody know. But do you know its course of Idagala? Idagala starts from the right big toe. It has its own channel. Its ending point is the left nostril. That everybody know. But Siddha literature talks the 12 nadi channels, and the Varma points are arranged on the along the channel. So this is how. So Idagala is related to lung. So if any lung problem or along the channel, if there is a pain, the concept is the energy is not supplied properly. So we can manipulate points and make energy to be supplied in that part. This is how it works. So we have a lot of therapeutic points. Those points can be applied using finger. This is how the therapeutic or physicians human touch plays has a role, and we can use some wooden sticks, some seeds. There are a lot of manipulation techniques are there. Even this is Varma massage. You all know naturopathy massage, Ayurvedic massage, but Varma massage is very unique. You know, it is a structured massage. We don't simply do any massage. There are points, you know, in the Rangoli, you dot, you keep the dot and connect the dots. That becomes the Rangoli or column. Same way, the connecting multiple Varma points is called a Varma massage. It is a structured therapeutic massage. So even migraine, whatever pain, it actually gives a lot of good result. So these massage and many other chiropractic methods and a lot of other yogic procedure. When old age patient people are bedridden patient, they can't practice yoga. So during each asana, the Varma points are getting stimulated. That is what patient is getting benefit. So we can do on behalf of patient, we can make the patient to do yoga passively. Okay, that is called a Varmasana. So this is also very good, very useful in the pain management therapy. We are doing these all therapies in Manipal and thermal Varma therapy. So there are many herbal based sticks like turmeric, and this is the Masi Patri in Siddha, Machi. The same herbal used in Chinese as a moxa. Same plant is called Masi, same plant. So we also use to apply heat on the Varma points. So for example, when lady doctor is there, less energetic, she can't do massage. She is very less energetic. So she can use these kind of tools to give stimulus to the Varma points. Similarly, Varma cupping is the Varma points. We can actually, muscular area, we can use the Varma cupping to reduce the pain. Again, connecting multiple points through cupping is called the cupping massage. So these all very well we are practicing. Recently, we included ultrasound Varma therapy because we found physicians, especially lady doctors, they don't have energy to do massage for many patients. So we introduced ultrasound Varma therapy where 1 megahertz and 5 megahertz, 3 megahertz, the ultrasound is given to the Varma points so that without much effort, physician effort, we can stimulate the Varma points. Again, Varma Ponnusi was one of the ancient method used in India using some needle, golden needle, the pricking thing, and that those needles actually we had a literature but not in use. So after seeing the acupuncture, we also started using based on our literature, the Varma puncture. So the Varma puncture and acupuncture points are not same. Only 30% of points are same. Remaining 70% points are unique to Siddha. So we are using different modalities to stimulate the points. So external therapy plays a major role in the pain management in the Siddha. Coming to the sleeping disorder, so again poppy seed decoction is actually working well, and we have many herbal paste. It is Thalam or Tapalam, already previous speaker told. That therapy is very popular, especially in the sleeping disorders. So again we can check pulse based on Pitta is more, Pitta is combined with Vada. Based on that we can select the herbal powder and ask them to apply as a paste. After 1 hour they have to take a bath. That day sleep is guaranteed, definitely. So similarly, even excess pittam is observed in the nadi, no sleep, then castor oil can be applied on the umbilicus, because umbilicus is one of the Varma point, and the big toe. Big toe is the starting point of Idagala and Pinkala. So this is how a lot of small manipulation we are able to use that. And the Varma points also can be stimulated by oil dropping. So Dharai is nothing but the dropping of the oil. So it gives like feather touch stimulation to the Varma points. So this is another way. So we can choose, once you know 1008 points and the therapeutic uses, you can select the points, you can select the manipulation methods. It is up to you. Okay, so this is how it works. Even Varma meditation, okay, if there is a pain is in the shoulder, you can select Varma points, 1 or 2 potential point. You ask the patient to meditate on that. Okay, you meditate to that point, actually we can see pain relieving. So this is called Varma meditation. So in anxiety also, same external therapies like sleep disorders, but the medications will vary. White lotus based medicine, Vendamre Churnam, it actually reduces the anxiety better. Asai means Jiraga based medicine will work better. Muttu is the pearl based parfum, pearl basma. It is actually very good for anxiety. So these are the medicine we use. And one thing we understand that the Varma therapy or Siddha external therapies are very unique, but less people are there in Tamil Nadu and Kerala, but rest of the country who will practice. So we started the course for Siddha Varma therapy where all Ayush doctors are eligible. So they can learn. It is just a 6-month course. So last 2 years we are doing it. So people from across the India, from different discipline, they are learning and they are practicing it into their practice. But what I want to say is, Varma therapy and other external therapies from the Siddha can be easily integrated in the palliative care, and it can be integrated by anybody, any system doctors, once you learned it. But to give the right protocols, at present we don't have much evidence actually, so more research are needed, so that we will be able to do in future. Okay, thank you so much.
Thank you so much, sir. For the kind attention of all delegates, a booklet will be circulated shortly. Those who are interested